I'm here to talk about one of my favorite topics, cannabis. And I wanted to explore with you all today cannabis in HOMeHOPe practice. So rethinking some of that cannabinoid science and applying it to what we do here at HOMeHOPe as the Biome Hackers. So I'm Jodie Duval, practitioner, educator, and cannabinoid clinician, and I created the advanced cannabis module at HOMeHOPe. So in this module, we explore how the endocannabinoid system can be safely, precisely, systematically integrated and aligned with the HOMeHOPe pillars. So to personalize this care through a systems biology approach, I'm going to talk through some of the main areas that we look at and a target or support with cannabis. Endocannabinoid system. So this is a systems biology lens. So the ECS regulates homeostasis across all systems, neurological, immune, endocrine, metabolic, and we approach it as a network-wide regulatory axis, not just isolated to one system or disease. The mitochondria and metabolic and redox applications. So phytocannabinoids like CBD, CBG, THC modulate mitochondrial function. They support membrane fluidity, calcium signaling, ATP production, and redox balance. And so this has wide application across neuroinflammatory, neurodegenerative, and energy deficit states. Some of the non-phytocannabinoid ECS tone optimization. So we often begin with non-cannabis ECS modulators. So this can include omega-3s, dietary aspects, magnesium, cold thermogenesis, breathwork, microbiota modulation, PEA, and supporting some of these endogenous anandamide and 2-AG regulation before or alongside cannabinoid therapy. Inflammation, immune modulation, and testing. So because the ECS interfaces with the immune signaling, we assess inflammatory states using markers like high sensitivity CRP, IL-6, TNF-A, lipid peroxidation, microbiome mapping. And so helping guide some of these therapeutic decisions for ECS-based interventions. So now into terpenes, minor cannabinoids, and chemotype matching as well. So when we look at the endocannabinoid system and what we use in terms of some of the cannabinoids, we use a all-round balance of what we're looking at, and it's called the entourage effect. So individual phytochemical profiles, including the terpenes like linalool, myrcene, and flavonoids, allow precision matching of cannabis products to symptom domains like anxiety and pain and cognition, inflammation, or sleep dysregulation. This is why I love cannabis so much, is that it has so many intricate combinations and support factors within that entourage support zone. And so cannabis isn't the only plant that has terpenes, but we can actually isolate some of these and use them, and some of these minor cannabinoids, which I'm so passionate about, in so many different applications in clinical practice. So the safety, drug interactions, and scope of practice with cannabinoids, they influence the cytochrome P450 pathways, hepatic metabolism, and the pharmacokinetics of many common medications. So this module that we are discussing, or that we look at in terms of the advanced cannabis module, it teaches us how to safely integrate some of the cannabinoids, assess some of these contraindications, and then collaborate via shared care models with authorized prescribers if you're not in a country that has prescription available. And then we're looking at also ways to genetically look at risk factors and associations with taking cannabis products or medicines. And this can also be associated with things like schizophrenia and risk factors associated with integration and other medications. Cannabis medicine is powerful. It still is so taboo in so many different prescribing methods and ways and countries, but in HOMeHOPe we integrate it only within that full systems context. Personalized approach, we look at detection and correction, and validated testing and individualized protocols ensure that we're being smarter, not harder, around using such a powerful plant, but it can also have, as anything, interactions if done wrong. So this is what makes cannabis prescribing both safe and clinically transformative when we look at it at this full systems context. We hope that you have a look at least cannabis in some form, research, see how it can be a part of some of your aspects of your practice, or if you're looking for support, make sure you find the best practitioner that you can find to support you with proper prescribing and knowing where to apply it in your particular case.